Welcome back to Girl Talk. We're filming today at William Thomas Jewelers. And you know, if diamonds are a girl's best friend, I gotta say pearls are probably a really close second. Bill, the owner here, just got back from Bora Bora. He brought back some fantastic pearls. We're gonna take a look later. We'll learn more about that. But next we're talking opioids, pain relief, physical therapy. We'll be meeting with Julie Lombardo from Capital Physical Therapy. Let's learn and see what she had to say. So I've read recently that up to 1/3 of Americans suffer from chronic pain. And that leads to, of course, painkillers and the chronic addiction that we keep hearing about in the news. Julie, I'm wondering, we've talked with you before about being a physical therapist and helping people with movement in their body, but I assume that involves dealing with people's pain too?
Yeah, very much so. We treat pain as physical therapists, so I like to tell people if something in your body isn't moving correctly, or if you have pain when you move it, that those are situations where a physical therapist can help you.
Awesome. Okay, and then, you know, speaking about pain, there's been a lot of talk in the healthcare world about opioids prescribing. You talk a little bit about that and what you've seen throughout your career?
Yeah, this is a really hot topic right now. I've been a therapist since 1997, so a lot has changed in the last, 20 years. The prescribing alone of opioid medications just from 1999 to 2010 has increased by 51%.
Wow.
And one of the things that I had really noticed was on a global level, I took a vacation to another country, and my girlfriend broke her collarbone. And while we were there, and we went to the emergency room, and they prescribed her ibuprofen. So it wasn't until I was in another country that I really realized that our drug issue here is really an American problem.
Why do you think it's increased so much?
I think a number of reasons, but one of the reasons I think people are asking for them, and they're demanding them from their physicians.
So for people at home who they've maybe heard this word, but they don't know exactly what an opioid is, can you explain what they are and what's the problem with long-term use?
Yeah, so opioids are a drug prescribed by a physician for pain relief. So they're not intended for long-term use. They're intended for short-term use. And the problem is that when people use them for long-term use, their bodies get used to it and adapt to the amount that they've been taking in. So their body actually needs more of it to get the same effect. So then their bodies become dependent upon the drug, and that can lead to a lot of other problems, including overdose, and can lead to other addictions like heroin addictions and that sort of thing.
Wow. So opioids are sort of like a super duper ibuprofen.
I think they're a little bit more than that, but yes, they're really strong drugs meant for short-term pain relief.
Okay, so people are feeling better with them, but there's this risk of addiction, and that's got to be quite a struggle.
I think there's a lot of statistics that I think are really astounding, and I think that the general public doesn't know the statistics, so let me share a little bit of that with you. So in 2016 alone, 214 million prescriptions were given out for opioid medications.
Wow.
Yeah, 1 in 4 people struggle with addiction. In 2016, there were 64,000 deaths due to overdose, and there's 1,000 people per day that are treated in the emergency departments due to opioid misuse. So 1,000 people a day, that's a lot. And the CDC, or the Centers for Disease Control, they feel that 3 out of 4 heroin addicts started with opioid medication.
Wow.
So it's really astounding.
Those numbers are staggering and concerning for sure. Yeah. We only have just a little bit under a minute left. What's your role as a physical therapist? How can that help?
Yeah, I think as a healthcare provider who treats pain and helps people with pain, we just need to make sure that we're getting the word out that there are other options for people, that they don't need to be seeking pain medication. And I think part of the thing that can help curb with that is both physicians and the public asking for other sorts of treatments outside of pain medication, therapy being one of them. And they need access to care.
Yeah.
They need quick access to care, because when people are in pain, they want something right now. So that's where we can help, is getting people in and getting them treated for pain in a safe, natural way.
Awesome.
Yeah.
Julie Lombardo's the CEO and a physical therapist with Capital Physical Therapy. You don't need a doctor's prescription or referral.
Right.
Absolutely. Thank you so much, Julie.
Thanks.
We'll be
You bet.
right back with more Girl Talk right after this.